Now, I talked about this in my last video, the quote from Charlie Munger. And obviously, he's an old man, long time investor, but he is the business partner uh, to Warren Buffett. And he said a long time ago, he said, "You show me the incentive, and I will show you the outcome." And so I said in a previous video that I'll link up above, talking about that the incentive is just too high for all this to go away. For a lot of people who think, oh, shoot, we got the vaccine, this is all over, end of the year, but the summertime, we're going to be rocking out there, we're going to be having a good time, we're going to be out there partying and at the clubs, doing our thing, etc. It's just not going to happen. So we're going to touch on a video and just to show you the amount of corruption. And this is what's going on within the hospital system for people who imagine that, a lot of these people who work in the hospital system, that they're, maybe the people on the lower rung, you have your, just your average employees. And for the most part, I would say most people have a desire to help people, which is why they work there. Some people are there for the money. That's just a fact. I've seen it even within nurses. Some nurses that just really don't like the job at all, but it pays a good salary. And it's the best thing. That's the choice that they made. So that's why they're there. So we're looking at an article here, and it says a woman was charged. It says a Northern California woman has come away with a 1.3 million in treatment costs after a bout of C19 last year. This is according to the LA Times. It says Patricia Mason was hospitalized for the virus last year in March and April. So you might be thinking she spent 2 months. She didn't. She spent 23 days. Another article over here that actually gives the dates. She spent 23 days in the hospital. It says the outlet notes that Mason and her husband owe $42,184 out of the total cost. So who do you think is going to cover the rest of that bill? All right, so out of a $1.3 million bill for her treatment, she's only contributing $42,000. Now, $42,000 is quite a bit of money, especially if you ain't got it, right? I mean, anything. If $100, if you ain't got $100 seems like, it's a high cost. But $42,000 for, especially for most people, $42,000 for a medical bill is very high. It says her hospital stay in the CCU, right? She stayed, which is primarily related to coronary, right? Your heart. It says North Bay Medical Center, and it says was $479,000, right? Just for being in the CCU. For 23 days, they charged her $480,000, while her pharmacy charges were $470,000, and the respiratory charges were $166,000. And it says she and her husband, who have 9 children, apparently they don't have TV in the house, and work 5 jobs. They told Outlet that they don't have $42,000 to spare. She is insured by her husband's union insurance. It says the California resident thought either all of the out-of-pocket expenses for treatment would be waived, and like who the like what is this bill's just gonna disappear. And it says to make sure people weren't slammed with bills, or that her bill would roughly be around $5,000, according to a People story. Now, there's a secondary from the LA Times, and I've said it before. Overwhelmingly in America, is one of the primary problems with the healthcare system is that overwhelmingly you have most Americans look like this. Between, it's like 70% are overweight, with roughly 30% of Americans being obese. And of course, most people who are overweight or leaning more to the obese side are typically living with things like cardiac disease, high blood pressure, high cholesterol, diabetes, etc. Right? And so this typically, when they come in contact with just any sort of a virus, whether it's the flu, maybe other respiratory diseases that basically forces them to lie on their back, all that excess weight makes it difficult to breathe. So that's why you see proning so prominently used to give relief to the lungs, so that the person's weight between the heart and other organs are not impeding upon the person's ability to breathe. And so that's why they end up proning people face down. But typically within the medical system, overwhelmingly, this is what most patients look like, whether it's a man or a woman. The average weight of a woman is around 178 pounds. The average man is roughly around 180 pounds. And so she looks like she's probably closer to like 190, 200 pounds. And most of the patients who are on the younger end of the spectrum, let's say between like 30 and 50 were typically around 250 plus pounds. And that's whether they were male or female. Typically, the ones who were on the younger end of the spectrum that were faring poorly with the virus were typically around 258 pounds. That's according to my experience from what I've seen. So it goes on to say here, or was it? And this is something else that I wanted to touch on, was that especially because of the limit to the number of people who can come see your family members, because of the restrictions, sometimes they'll be like, oh, you can't come because they're getting some sort of a treatment. And we're just going to touch on something right here. It says, it was bad enough that Patricia Mace's husband rushed her to the emergency room on his birthday, and he didn't see her again for nearly a month. When you can't lay eyes on your family members, you have no idea what the hell's going on in there. It says that was transferred. It says that she was transferred in the middle of the night to a different hospital, one that could better care for her deteriorating condition, and that her husband had no idea where she was or even how to find her. And this is what I say, when you don't know what's going on, you can't lay eyes on your family members. Doctors aren't calling you, as it says here, that her doctor called him 2 days later to break the news. It says his wife, the physician said, had less than a 30% chance of survival. And many times, a lot of family members call, and of course, because of HIPAA, really don't give out information. We're not even supposed to acknowledge that the person is in the hospital, but because people can't come and stop by, they give a little more slack. There's a little more leeway about information that's given, but overwhelmingly, I just typically give it to the doctor if they have more in-depth questions. And so people will call back and they'll be like, I haven't heard from the doctor in several hours. Or they don't call them and they'll be like, well, we'll let the day team, take care of it and let them get back to them. And so family members are basically left in the lurch, not knowing what's going on with their family members until they get a call that we're intubating your loved one. And typically, overwhelmingly, most patients who end up getting intubated do not survive. And of course, most people don't see the deterioration of their family member, so they're like, yes, do everything, not realizing that, like, overwhelmingly, like, most don't, like, once you get intubated, it's more than likely that you're not going to make it. And so it says, then the medical bills began to arrive. The grand total to save the 51-year-old woman, $1,339,181.94. And so, just so that we can get an idea, again, she only spent 23 days. I believe it was from, so she basically spent, she was admitted, right? It says Patricia Mason was hospitalized from March 28th to April 20th at North Bay. Her medical bill totaled $1.3 million. So she spent 23 days, right? She spent 23 days in the hospital, right? So we'll take that 1.39079, right? 1.3, and then we'll divide that by the 23 days that she spent in the hospital. They were charging her $58,000 a day. $58,000 a day. What the hell were you doing to this lady for treatment that cost her $58,000 a day? That is exorbitant. It's amazing that, and of course this is paid for via the insurance companies, because according to the CARES Act, like the insurance companies cannot deny the claims, and that even goes for testing. And there, I was reading another article where somebody went in for a test, and it cost them, it was like $20 for the test, and then they charged them another like $900 to get the test read. And it was like, what? But the unfortunate thing is that that's the problem, is that according to the CARES Act, it has to be free, right? So as a result of that, of course, that manipulates the free market, right? So instead of there being competition about how much people are going to charge, because we'll do it, right? I'll do it for $650. Somebody else will do it for $625. Someone else does it for $600, right? Until the market bears what the market is going to bear. But when the government turns around and says that the insurance company has to pay the cost, well, then cost will naturally go up, because the insurance company will have a hard time fighting because the government says no, you have to um, pay for the cost. Now, of course, if it's under like the government insurance, then obviously the government isn't going to pay that kind of money. But private insurance companies are getting taken for a ride. And this is a sad thing. This is what I said, that, right? The incentive. Show me the incentive and I will show you the outcome. Because the incentive, right? The incentive is so high. The outcome is just more cases. It doesn't matter if the swabs are broken and there's like a ridiculous number of high false positive. It doesn't matter that the flu disappeared, right? There was another article here about Danny Eschini, who was a cancer patient. She ended up going into the hospital for what looked like, as he says here, for the flu and pneumonia symptoms. She spent 3 days. She spent 3 days in the hospital and was charged $35,000. And of course, because she ended up with a diagnosis right there, of course, it costs more to treat such patients. And this is the problem with dealing with government involvement within the medical system. People wonder why healthcare costs so much, and it's just because the government basically picks and chooses who is going to win. And so this is why I say, for people who think that this is going to go away, you're just going to get a vaccine, everything is just going to open back up, life is going to go back to normal, it's not going to happen. If you think the mask producers, these large companies that are going into the mask business, Biden initiated oh man, I forgot the defensive act, whatever it is, that he can tell businesses to start making equipment, and of course it's paid for via the federal government, where they just print out the money and send it to them. This is not going to go away. If you think the pharmaceutical companies are going to just not let people take the vaccine, willy-nilly, and think that you're just going to go back to normal, it's not going to happen. They're going to come out with therapeutics, etc. There is way too much incentive for all of this to go away, especially in talking about that most Americans basically gave up their freedom for what they thought was going to be government taking care of them. And of course, the government is like, yeah, we'll take care of you, but we're going to take care of ourselves first. And they're basically robbing the people. And so this will not go away. I did another video talking about how basically they're slow walking the vaccine, not just here in New York, but also across the globe, because this isn't going to go away unless the people rise up and demand it. If that is not the route that people are willing to go, you're going to see people become unemployed by the millions in America. Many of them will become primarily dependent upon the government for a bailout. And once you become dependent on the government for bailout, you end up like certain communities that typically only vote a certain way because they are highly dependent upon the government. And it's like Jesus said, you give a man a fish, he lives for that day. You teach a man how to fish, he lives forever. And that's basically what many of these people in power, they just want to give you that fish for that day so that you have to come back the next day to be able to get the next fish so that you can live, instead of allowing people and teaching people how to do things for themselves so that they become independent. The government is basically working overtime to make as many people as they can become dependent upon the government.